So good afternoon and welcome to the Healthy Aging Core webinar, Self-Management Programs, What's in Them for You? My name is Barbara McMillan and I'm Provincial Community Engagement Coordinator for United Way of British Columbia's Population Health Team, and I'm very pleased to introduce this very important learning event. I'd like to begin by recognizing that I'm speaking today from the traditional and unceded territory of the Musqueam, Squamish, and Tsleil-Waututh First Nations, and we also acknowledge the traditional and ancestral territories of all First Nations in what is now known as British Columbia, on which we gratefully work and gather. To manage the session and ensure good audio and visual quality, there's a few details we need to point out. Everyone but the presenter will remain muted and cameras will be off. Please feel free to introduce yourself in the chat box and where you're joining from. And at the end of the presentations, we'll have about 10 minutes for Q&A and discussion. So please use the Q&A feature to ask questions at any time and also indicate who your question is directed to. And lastly, this webinar is being recorded and it'll be posted on Healthy Aging Core along with the slides in the next few days. So today's session will be an introduction to self-management and the programs offered by Self-Management BC. We're really excited to be offering this session today because we think the community-based senior serving sector should not only be aware of the programs and resources available to support self-management, but could also be promoting them to older adults they connect with in their programs and services and getting more directly involved. And this webinar will explain the reasons why healthcare and community-based senior service providers should be encouraging participation in self-management programs. Our presenters will review the various program options, who they're intended for, what active self-management is, core self-management strategies, what participants can expect during the programs, as well as the significant benefits that accrue from them. Also, health or volunteer opportunities for seniors and for others. How to access the programs and all kinds of information to really get you started on understanding self-management and getting engaged with the programs. So I'm very pleased to introduce our presenters, Karen, Charles, Alan, and Murat. But I'm told that they will provide their own introductions themselves as part of their presentation. So in any event, we really appreciate them taking the time to be with us today. And now I will turn the session over to Karen.
Right, I'll just get my share screen going. Oh, there we go. I need to share screen. There we have it. The slideshow from beginning. Okay. Welcome, everybody. My name is Karen Hanna. I'm with Self-Management BC. I've been with the organization since its inception 22 years ago, and I'm currently the lead of the Health Coach program. So welcome. Self-Management BC, we are supported entirely by the BC Ministry of Health Patients as Partners programs. So there's no cost to our partners or to participants or the volunteers in our programs. We are part of the University of Victoria Institute on Aging and Lifelong Health, but for the last 22 years, we've been delivering these programs out of our office in Ladner offices. And since the pandemic, many of us are working from home and continuing to work from home. So the self-management programs that we're delivering, these are evidence-based programs. Are standardized. They're really considered a gold standard worldwide in terms of patient self-management education. They're endorsed by the Health Council of Canada, the U.S. Center for Disease Control and Prevention, and the U.S. National Council on Aging. People keep telling us they've never heard of us, although we have to date trained almost 8,000 volunteers around the province who are delivering these programs and have delivered them to close to 52,000 people as of this date. So we're talking about self-management programs, for people with chronic conditions. And what is a chronic condition? We consider a chronic health condition to be any ongoing physical or mental health issue, so very broadly defined. Things, it could be, heart disease, arthritis, diabetes, asthma, depression, anxiety, any chronic condition, some may not have been diagnosed yet. They're just experiencing symptoms, having difficulty managing their health. So why is this important? Why are self-management tools and these programs important in helping people with chronic conditions? Because 1 in 3 of British Columbians over the age of 50 have one or more chronic health conditions, and are maybe having difficulty managing their health. When you're diagnosed with a chronic health condition, a new chronic health condition, there's a whole range of new tasks that a person has to suddenly take on. They need to recognize and act on their symptoms and make effective use of their medications and treatments, and deal with the flare-ups of their condition, and make sure that they're eating well and getting physical activity to the extent that they are able to keep moving, and deal with the psychological stresses and their relations with others, managing work if they happen to be working, or school, or whatever it is. So a whole range of things that people need to suddenly be taking care of when they're diagnosed with a chronic condition. Health is, our health is our own responsibility, but it involves a whole lot of things, in our life and in the people's lives around us, because it affects others. And when we have a chronic health condition, or really for anyone, we are our own biggest healthcare provider. One of the studies that has come out of the UK, they looked on to see what was the length of the average length of time that people had face to face with their care providers. And it was about 6 hours per year that they're face to face with their healthcare providers. So for 364 and 3/4 of days of the year, we're managing our health on our own. And we may know things that we could or should be doing that would lead to better health. But as I say, there's always a gap between the knowing and the doing. So self-management, that's where we come in. So what is self-management? It is, we define it as the tasks that individuals must undertake on a daily basis to live well with one or more chronic conditions. And the tasks include their confidence to deal with their medical condition, their health issues, but also with their day-to-day functioning and maintaining as normal as a routine as possible. And self-management also means dealing with emotions, those day-to-day challenges that one experiences. So again, it's the tasks or activities that people are doing actively or passively to maintain their health, and deciding what they're going to do every day. And our programs are intended to help build what we call good or active self-managers, people that are taking an active role in managing their health. So a difference from traditional health education, from the self-management education programs that we're delivering, is that instead of health professionals identifying for people what their problems are and what they need to do about it, the self-management is about people deciding for themselves what they see as their problems and what they're prepared to do about it. So self-efficacy. Dealing with those chronic conditions, all those things that I talked about that suddenly people need to be dealing with, it can be overwhelming. And so, as I say, we may know what we should be doing. It's difficult to get started in making those changes, and it can be all too easy to lose the motivation and just to give up if you're running into problems or difficulties. So all of our programs are designed, sorry, I don't know how to get rid of this at the bottom there, but if it's lighted. So self-efficacy is defined as one's belief that you can perform a specific behavior or task in the future. That's Albert Bandura. So it has to do with your confidence in your ability. It's not just having knowledge or skills that determines a positive health outcome. It's about one's confidence and belief in their ability to use the knowledge and skills they had to affect a positive outcome. Okay, so let's see. So self-efficacy, it's believing in your ability to overcome the obstacles and difficulties that you have and to achieve whatever positive outcome that you know, would like to work towards. So that's what our programs are dealing with. Okay. So just lost my screen there. Okay. So what happens in self-management programs? Our programs are helping people to learn how to get started in taking action towards their goals. How do they make decisions? How do they solve problems? And those first three are the core self-management strategies in all of our programs, all self-management programs. You know, how to make a decision, how to get started in taking action, and how to deal with the inevitable problems and challenges in lives. And those can be applied to whatever circumstances in a person's life. So they're also learning to deal with difficult emotions, anger, fear, frustration, and to work more effectively with their healthcare providers and with other resources. Okay, Charles, I'll let you jump in there.
Okay. As Karen mentioned, my name is Charles, and I am a program coordinator, and it was mentioned on the screen that I work in Fraser South. That may not mean a lot to people, but basically we have Fraser Health divided in several areas because of its size. So I look after Delta, Surrey, and White Rock, and that's my area of responsibility. So here's a brief overview of self-management programs. They are evidence-based. The program Chronic Conditions started off as a research project at the university at Stanford University, and then was translated into a program that we now have. It's for all adults ongoing physical and mental health conditions, so it covers a very broad area. We also have many family members and caregivers, spouses, friends that are interested in learning about self-management strategies. They also participate with their partner or their spouse, whatever it might be, their father, their mother. We have a lot of those situations occurring, so they know what's going on and they know what's being talked about. And people can self-refer to the program, but we also have healthcare professionals that also refer to the program. And as Karen mentioned, we are supported entirely by the Ministry of Health. So everything that comes with our programs, whether it's the textbooks, whether it's the room, whatever it is all offered to participants at no cost. It's free of charge. And it comes in a variety of formats, which we're going to get into shortly. Next slide, Karen. So these are our program materials. Every participant that enters a program, whether it's a health coach program, whether it's a small group setting or a self-study format, and we're going to talk about those a bit later, they all receive one of these two books. These books on this, you can't really tell how big they are, but they're about 8.5 by 11, and they're about 400 pages. So everybody receives that book. And as you can see, Karen and Marette both have those books in hand. So it's pretty substantial, and there's a lot of information in those books. Next slide. Oh, there's also,
yeah.
And there's also the toolkits that comes with a separate program. We have several programs, so we'll get into that as well. But the chronic conditions program is for people that have more general conditions, and then there's the pain program. Now, these are the programs that we offer here in BC. These are more of the small group versions. As Karen mentioned, the chronic conditions program focuses on people that have mental health challenges, heart conditions, respiratory issues, other medically related problems, and it's offered in English, in Chinese, and for the Aboriginal community. And the formats we have here is we have an in-person program where you're getting together with 8 to 10 people, a virtual program which is on Zoom, or it's on the phone. We have a self-study program as well. And we have an online program that's totally on the computer so that nobody calls them, and they go on, they read, and they interact with people on the computer. Then we have the chronic pain program, and this is for people that have chronic pain from whatever source. It could be arthritis, it could be ankylosing spondylitis, it could be anything from a workplace accident to complications after surgery. So, and that program is involved, is in person and offered virtually and as a self-study program. Now we have the diabetes program, and that's in English and Punjabi. And when we say Punjabi, the materials are actually written in Punjabi and delivered in Punjabi. And these are in-person, virtual, and self-study programs. And then we have one last program, that's the Cancer Thriving and Surviving program, and that's in person only. Now, as you know, as we know, a lot of people that have various health challenges, whether they be mental health or other things, also have other things going on. So the person that has a mental health challenge could have a lot of pain. They could have diabetes or other things going on. So a lot of these programs help to address some of those other issues as well. Next slide, please. So what does this actually look like in terms of the in-person or the virtual programs? So the chronic pain, diabetes, chronic conditions, and cancer, thriving and surviving, that's only offered in person. The full program, we like to call this the full meal deal because everything is covered. It's roughly 2 to 2.5 hours a week, and it goes for 6 weeks. And it's not just a straight lecture. There's educational material provided. It's interactive. People are contributing. They're problem solving together. There are 2 trained facilitators, and the groups are usually 6 to 8, sometimes up to 10, but most of the time it's a small group setting. And for the virtual program, we use Zoom. And for the in-person meetings, we meet at places like rec centers, libraries, senior centers, churches, what space is available to us. Next slide, Karen.
Yeah, I switched it there. Mhm.
Okay, now we also have a Reader's Digest version of the full-length program, and this is involved, and this is for the chronic pain, the diabetes, and the chronic conditions program. This is a condensed version, and it's 45 minutes to 1 hour. It's once a week. It's for 6 weeks. And just like the full-length program, it's educational and it's interactive. There's 1 to 2 trained facilitators. The groups are 3 to 6 individuals. And the platform is on Zoom, so people can come in on their computers, or some people that don't have a computer can call in, and we provide all that information for them. So it caters to people that may not be technologically comfortable with a lot of things, so they can call in on their phone and be an active participant with everybody else. Next slide.
Yeah.
Then there's the health coach program. Did you want to talk about that, Karen?
Sure. So the Health Coach program is a program that we've designed in-house based on our research, using the strategies and the tools that are used in all of our other self-management programs. So again, those 3 core self-management strategies, as well as Living a Healthy Life reference book. People are paired 1-to-1 with a peer health coach. Their pairings, we match them with similar age, gender, chronic condition or health issues, and life circumstances as best possible. And we get excellent feedback on our matching abilities. The participant receives a coaching call for 30 minutes once a week for a period of 3 to 6 months, and it's free. And what health coaches can support participants to do, they can help them decide on their goals and their actions that they want to take to work toward those goals, identify and problem solve barriers, to support them, encourage them to become more self-confident by practicing these things, and to help them be more motivated to initiate and maintain those health behavior changes long-term.
Okay. The question you may ask, does this actually work? What kind of results have come out of this? And you're going to be hearing about that a bit later on from both Ellen and Maurette. But this program has been researched, and the Ministry of Health wants us to report to them what kind of outcomes are we seeing and experiencing, and the participants going through. So we use a scale called the Patient Activation Measure. Next slide, please. And the Patient Activation Measure is actually a survey, and it refers to people's ability and willingness to take on the role of managing their health and their health care on a day-to-day basis. The actual measure itself was designed to assess a person's knowledge, skill, and confidence in managing their health. Now, the survey is segmented into four progressively higher areas of activation, depending upon how they answer the questions. So they go from level 1, which means that they have they basically don't do anything. They just do what they are told, and they don't activate a whole lot of things in their lives. They don't take responsibility for a lot. It's somebody else's, and they don't feel that they can actually move forward in taking care of themselves. When you get to level 4, people are seeing significant behavior changes that result in people actually managing a lot of things that they do on a day-by-day basis with their health. For example, getting some exercise, getting a proper night's sleep, eating correctly, dealing with depression, dealing with ways on how they can handle their chronic pain, how they can work on their diabetes and keep their blood sugar levels under control, and a lot of behaviors that impact their health condition significantly. Karen, next slide. So what are some of the results that we have seen so far? So as patients with the higher PAM scores reported significant better health and significantly lower rates of doctor office visits, emergency visits, and hospital nights. So basically, they are managing on a daily basis so they don't have to go to the doctor as often or go into the emergency room. Individuals with higher PAM scores also showed that they had significantly healthier behaviors as well, attitudes towards themselves and their health condition. PAM scores also are strongly associated with adherence to treatment. And we're not only talking about prescriptions here, but treatments that have been advised to them by their physiotherapist, occupational therapist, nurse practitioner, the pharmacist. So they're adhering to their treatments in a better way. As well, the PAM score is also strongly associated with doctor-patient and their healthcare provider communication. So they became more effective in dealing with those short visits, because sometimes they are short, and implementing those suggestions and the plans that the healthcare provider, whatever it might have been, or was supplying to them. So in basic, they were more effective in taking care of themselves and carrying out the plans that their healthcare provider was helping them with. Karen?
Okay, so just to reach us, here is our contact information. We're offering programs again for adults of all ages. And I think the eldest person in one of my workshops was 103. Charles, I don't know what the eldest was that you've had in yours, but people from all walks of life. The programs, again, that's self-referral and there's no cost. They can give us a call, they can email us, they can register themselves on our website, and really encourage all of you to have a look at that website as well. And you have the opportunity to get a little bit more information and see what we're offering all around the province. So I guess we're not quite finished. We're going to move. Oh, go ahead, Alan or Charles.
Sorry,
move on to
sorry,
Alan.
just one thing I was going to mention here. Sorry, I'm not sure if you're going to mention this, but we do also train our own volunteers and our leaders. Yeah. We have a program for the health coach training program and also for the small group versions as well. Nobody is allowed to kind of walk into a situation without being trained first. So these people are prepared for what's going to be coming and how to work with the participants.
Yeah. Which is a lovely segue into our next two presenters who happen to be volunteers. So Alan, I'll let you go first. Introduce yourself.
Can you hear me first of all?
Yes. Yeah.
Okay, great. Well, my name's Alan Gardner and I am a coach with the Self Management BC program. And I got to that position by having some challenges in my own life. I'd had a car accident, I had supine syncope, etc. And through another program, I found a brochure for Self Management BC. And I signed up for one of the 6-week programs, 2.5 hours a week. and was really impressed with the kinds of things that I was learning. It was changing my perception and even my expectations of myself. So I'd had the car accident, I had some conditions, and I'm not going to tell you too much more about that. Rather, I'll tell you about specifically Miles, who's a program participant that I've been coaching. And just let you know what it was like for him, like the way he presented initially, the kinds of challenges he had, some of the breakthroughs that he made, and some of the benefits. And when I talk about the benefits that he realized, I'm really just going to talk about the changes that he made in his own life. I'm going to try to do this reasonably briefly. So Miles has been diagnosed with something called CAA, which is cerebral amyloid angiopathy, which is a short path to full-blown Alzheimer's and dementia, or at least is perceived to be a short path. But nobody, there's a lot of research going on in this area, but it's really difficult to find somebody who will tell you, well, here's the path, and you can expect to be, 2 weeks, 2 months, or 2 years here, and progressively move to the other end. It's true for some people, it'll be a quick path, and for others, they may never get there. And there's so much research going on right now that part of the coaching with Miles was just looking at what's available out there and what do you want to do? Assume the worst, assume the best, or be realistic. And that's the process we've been going through a 13-week program, roughly 45 minutes per session on the telephone. So this is a one-on-one, but over the telephone type program. So when I first met Charles over the phone, he was generally depressed. He had mood swings and cloudy thinking. He was facing a rather uncertain and somewhat gloomy future because, again, if you look at the research, there's lots of exciting things happening because it's affecting so many people, but they aren't necessarily getting, aha, we have the cure. So generally speaking, Alzheimer's dementia, there isn't a cure, but there are all kinds of things that maybe just through healthy living, good exercise, good diet, and that sort of thing, where you can prepare yourself to be in the best possible condition to handle some of these things as they come along. And that's basically the way Miles has seemed to really respond. He's been married for 30 years, and a year ago or so, he had a grand mal seizure, which got him to go and get a diagnosis, and that was the cerebral amyloid angiopathy. And so some patients experience rapid cognitive decline, and older patients, want to carry on with activities, but some of the meds they take affect that as well. In Miles' case, he had a lot of loss of balance because of the medications he was taking. And again, no known cures for CAA or Alzheimer's dementia. And sometimes people die within a decade. First meds turned him into a dizzy and hungover condition, and no known paths to follow to mitigate these conditions. So I'm going to tell you right to the benefits of the program. What Miles and I would do is we would talk every week for about 45 minutes. It was really after the initial part where people are in a kind of why me and poor me state. They didn't ask for this thing to happen, this event in their lives, or this condition to occur. And now they're finding they can't do a lot of the things that they really enjoy doing and really define them and for themselves in life. I'm a skier, I do this, I've got a sailboat. And in fact, he did have a sailboat and he is a skier. And he had a lot of these things that weren't apparently available to him anymore. So I want to just talk through just listing some of the changes that he's made in his own life through the program. And again, as a coach, what I try not to do, and I believe it's pretty much standard, is I try not to tell people what to do, but to get them to think about what it is they want to do, what is the problem or problem to solve or opportunity they want to pursue, and then put some kind of a plan in place to do that. do it and then check the results and change the plan as required. And that's really good on a week by week basis, especially when they're at the front end of the program and they need to learn some of these techniques and the discipline of it. But it's equally important that they start thinking about, well, while they, in this case with a CA, while you still have your cognitive abilities, what does you want to do to prepare for an eventuality that may never come, but where you no longer remember who you are, where you live, and who's taking care of you. And it's really important to, while people have their cognitive ability, to start thinking of some of those things instead of finding over time diminishing ability to do it, that they just end up not knowing who they are and where they are, that sort of thing. So the value and benefits to Miles really come through the things he's accomplished. So just tell you, I've got a list of these things that are in front of me. He started exercising quite a bit more. He had been paddleboarding and sailing. He was no longer able to do that because of balance. But now he's back to sailing. He put the boat away about 2 weeks ago. He plans to walk to the ski hill this winter. He is a greeter, like almost at Walmart. If you're on the ski hill, he meets you, greets you, and gives you some information. But also, he loves skiing, and he's going to walk there this winter and let the ski hill unfold for him. He bought 2 electric bikes. His longest trip with his wife Eileen was 40 kilometers. Unfortunately, his battery wasn't fully charged, and so it was a real effort for him to get back. The 20 kilometers back. He's considering starting a local support group, kind of like a coffee style meeting once a week for people who either have Alzheimer's or they're caring for somebody with Alzheimer's. And it's not a formal program. It's not Self-Management BC sponsored or constructed, but he really wants to put together something where people can get together and just share their experiences in an informal way, once a week, that sort of thing. Or maybe it would be once every 2 weeks. He's also shown a lot of initiative in dealing with his health condition, the CAA. He's gotten all his medical records and imaging reports. He had a neurologist who brought him through these things and gave him the diagnostic result of you have CAA. But what he's done since then, he's gone out on his own, with no suggestions or anything from me, but on his own, he's got a new neurologist who happens to believe that there are other possible causes for the symptoms and conditions he has. But they're doing more research, and they'll find out. He may have CAA, or it may be because he had that grand mal seizure, or he had some trauma to his head. He uses his paddleboard these days. He pursues all of his own medical appointments. He views his doctor as a partner. And the evidence of that is saying, instead of saying, doctor, tell me what to do, he says, well, what do we do next? And what do we do next on a particular issue that he wants to talk to the doctor at that point in time, because it's one that is affecting him and he wants to deal with now. He researches CAA and Alzheimer's dementia, and he assumes the best. He's gone from poor me and why me to this isn't over until it's over. And I'm going to do everything I can to learn about CAA and AD, and I'll help other people as well. But he's going to do it now while he's got all of his cognitive abilities. His wife can't see that he's lost any cognitive abilities at all. He has formed a long-term vision for himself and the results he wants to achieve. And it's almost like the title of the books that participants get, Living a Healthy Life with Chronic Conditions or Chronic Pain. His long-term vision is to have a healthy, happy, and honest life. So healthy, but also happy, bringing in that element. He wants to have some enjoyment out of it. And the honest part is just being realistic and understanding as limitations come. He's going to have to deal with those too. But anyways, he's keeping his brain active as well through problem solving. And there are some other things they can do. So if you have good medication, you have good exercise and good nutrition, and you do things and use your brain. These are all things, nobody will say, here's the formula and you do this. But these are things that just logically seem to prepare somebody better and put them better health, so that when they, if they go down this path, they either slow it or maybe they never go all the way. And these are the kinds of things I've learned from Miles and through our discussions. So for the, like, I'm a volunteer, but as a volunteer, I get so much benefit from coaching people. So he has set goals, and he'll use his cognition while he has it and think about how he would like things to be if he ever goes to the end of that path. So focusing on healthy food, exercise, and keeping his mind active. And, you know, so I've told you at the beginning what I was going to talk about, sort of talk to you about it as quickly as I could. Briefly, my experience as a participant, I learned about things that made me change my perception and my perspective on what I was doing. And I started to be much more of a self-manager. I'd had a car accident and so on, and it's a fine syncope, but I didn't make those things be the barrier that kept me from doing everything. I learned that basically, if I believe I can do something, I can do it. And by the way, I walked 5 miles a couple of times last week, and I've been walking like 2 to 3 miles. And in my condition, that's pretty good. And the big change was what I learned by speaking to people like Miles and other people I've coached, that if I think I can't do things, I can't do them. The moment I think I can do them, all of a sudden things change. Like, I've got to be careful going down steps and hold on to the railing. Just 2 weeks ago, I decided that's not true. I don't have to hold on the railing, and I don't have to do anything except walk down those steps. And if I go onto a curb, I can hop up on it. I don't have to do things slowly for fear that I might fall. These are things that I didn't learn in one day, but I learned over, you know, it's almost 4 years now that I've been coaching people with all kinds of different conditions and perspectives. The same solutions, though, are useful almost no matter the condition, no matter what the pain might be. It's first of all to get out of the trough between the two peaks in a wave and realize that you can get up the back of the wave, even though maybe you've fallen in a boat and you're worried about, you know, dying. If you get to the top of the wave, you might find out that you're only 200 yards from the shore, or there's a passing boat. So while people, when they get into this program at the front end, why me? Poor me. Oh my gosh. Once they start recording small victories, which happens when they plan to deal with certain problems and take more ownership of their health, they start climbing up the back of the wave. Small victories turn into the capabilities to make lifestyle changes and a real difference in their own lives. So I've described to you as best I could just part of the journey of Miles, because we're not coaching with Miles anymore, but he's on his own, and he's very confident that he has learned the kinds of things that prove to him he can make changes in his life that really make a difference. And he's assumed ownership of his health team and his personal health. So that's really what I've got to say. Oh, I can't hear you, Karen.
Mute myself again there. Thank you, Alan, for sharing that story about your coaching. And Marette, if you'd like to introduce yourself,
Okay.
share your comments now. Thank you.
Hello, everybody.
Hi.
I first learned about the Self-Management BC programs when a colleague was orienting me for my new job after I moved to British Columbia. I'm a retired occupational therapist, and so it's been about 15 years that I've known about the program. And I started by suggesting it to clients. And one client in particular sort of sticks out in my mind, and the benefits that she gained. I'll call her Carol to protect her privacy. She was a young woman in her early 30s. struck one evening as a pedestrian crossing in a crosswalk. She sustained significant injuries and was physically not very mobile and very frustrated and discouraged when I first met her. It took my skills as an OT to get her to where she could venture out of the apartment. And we looked for something that she could do that was within her limits that would also pull her forward. And I thought of this program that my colleague had told me about. And she attended a couple of the programs, the chronic pain and the chronic condition ones over the course of time. What I discovered was she was learning more than just the logistics of how to deal with her injuries. She took on a new perspective. She was less stuck. She no longer talked about how victimized she felt because this total stranger had randomly struck her to the ground and turned her world totally upside down. And so as a result of that interaction, I guess, I subsequently sent more clients to the program. Then when I retired, I took a look around to see what was in my community that I might participate in as a volunteer. Philosophically, I feel very strongly about leaving people in a better place than when I found them, whether it's an interaction in a grocery store, coffee with a friend, even a ride on a bus. I believe that that improves our community, and over time there's a ripple effect and it makes life better for all of us. This program helps me to personify, I guess, those values. So I work in quotes, both as a health coach and as a leader instructor for 3 of the 4 programs, both in person and virtually. And I don't know what I love the best, probably the health coaching because it's one-on-one. So the benefits. I like that the self-management programs are a kind of easy classroom setting for people to participate in, whether it's virtual or in person. There's a small group so they can get to know other individuals that are struggling with similar dilemmas. They're not maybe as confrontational as a one-on-one situation. And yet they're learning the skills that will help them take responsibility for their own health care in terms of seeking information, researching information, trying different strategies, deciding if those strategies work for them. And so then if they decide to look at the health coaching, they have the opportunity to spend a longer period of time, because it stretches out over several months, to stop once a week for 30 to 45 minutes with someone, and I hear this all the time, someone that will really listen, someone that stops and just hears whatever is happening in their world today, even though that individual is not part of their world. The focus is individualized. The participant decides what their focus is. Most recently, I had a lady who came to the program because she was struggling with poor sleep and a lot of anxiety. We spent a couple of weeks talking about that, and then she quickly discovered, much to my surprise, that the real issue was her pending retirement. And she has spent the last few weeks researching all kinds of aspects of retirement, her fears about not having a steady income, her anxiety about losing contact with work-related friends, and all the other things that can go with looking at pending retirement. And so I guess she and I were a good match, although we first started out with a focus of anxiety, and I was focusing more on breathing exercises and sleep hygiene ideas, and she was trying some of those. We at some point made a 90-degree turn, and she's done a great job of researching her pending retirement. Makes me think I should have done more pending for my retirement. But so it is a ripple effect. I hear that individuals that are participants in the program often ultimately become a volunteer, and I think that's great because they come to the program with the knowledge of what it's like to sit on the other side, and they can share their personal experiences of setting an action plan each week, which can be totally foreign if you've never sat still and thought about what you want to change for yourself in the coming week. That is a small and doable step. And the success. I think the success of those small steps is the biggest benefit. And Charles spoke to the statistics about how people's actual interaction with doctors and trips to the emergency department has shifted. But I think that there's a whole lot more personal success going on in the background that is then showing up in these other measurable variables. I just think that the program is underutilized, and I hope that today's presentation makes all of you more aware and maybe willing to put your big toe in the water and give the program a try. Thank you.
Thank you, Marette. Yeah, that was wonderful. So yes, the people who are coming to our programs, again, any walk of life and all ages and such a broad range of health conditions, but many other challenges going on in their lives as well. So it's not just strictly health related things, as Marette has talked about, that we might be helping somebody work on. Again, the strategies can be applied to any circumstances. With the volunteers, yes, many of our volunteers are past participants. We're always looking for people who are interested in volunteering to become a program leader or a coach. So if you have an interest in that, be sure to touch base with us. Okay.
Karen, we have a question, and it's absolutely terrific that there's such a range of programs and that they're so accessible and free. But the question is whether there is a toll-free number
Yes.
for the toolkit program, because some people don't have long distance plans, and so that may be a barrier.
Yeah, they can get a hold of us if they're, in the Lower Mainland, a 604 number. There is a toll-free number province-wide, and I see that Gemma put that into the chat. Maybe we can pop that last slide up on the screen if you'd like to, which has our contact information, the 1-800 number, as well as our website. They can contact us by email as well. So there's lots of different ways to get in touch with us.
Great. And I didn't see any other questions. So I think that speaks to how comprehensive the presentation has been. But if people still have any questions that they want to, oh, it looks like one has just come in. Oh, maybe not. To feel free, we've got a few minutes left to feel free to put them in, but I just wanted to make some comments. Years ago, back in the late 1980s, I worked for the Health Promotion Directorate of what was then Health and Welfare Canada. And it was shortly after Achieving Health for All was introduced, a framework for health promotion. And That framework, built on the premise that health is not the absence of disease and that it incorporated social determinants of health. And the focus for health promotion is on reducing inequities, on increasing prevention efforts, and enhancing people's capacity to cope. So self-management is a really key health promotion strategy, and one that we think really needs to be promoted among our Better at Home partners, our other agencies that we work with at United Way, and the whole community-based seniors services sector, because it's it's as Marette pointed out, it's underutilized, and a lot of people may not be aware of it and really need to be. And so we are going to be undertaking a variety of initiatives to be promoting it, some internal orientation and planning, and more promotion on Core BC and our Core e-News. And so if participants for today's session are interested, we will be make sure that you're signed up for the Core e-News, which you can do at the bottom of the homepage of Core BC, because this is just the beginning.
Mm-hmm. Yeah, I see, Marcy, you had your hand up there.
Hi there. I just want to ask, because we work specifically with older adults, and a lot of the people who come to our services are 75 plus. And so I just wanted if you could give a few examples of working with that older population. A lot of them are lower to moderate income, just so that people get a picture of what it would mean for an older adult, and how and any examples that you could give or that would be relevant or helpful for that group of people. And also, I would say we have some people who are reluctant, sometimes need a little help at the beginning to get themselves going in this kind of direction before they can actually feel comfortable in a group. So if you can answer either or both of those questions, that would be wonderful.
Yeah, well, I'll start, and maybe the others can pipe in as well. But so we offer this menu of options, as it were, for people, and they can choose whatever they're most comfortable with. So for some people, it might be just requesting the toolkit materials and the Living a Healthy Life book to be, mailed to them, to have a look at that to start with. Some people are ready for a group program. There may be one located in their community. If they have ability to get on Zoom, and it's surprising how many of us have adapted to the Zoom culture since the pandemic, but they can participate that way. They can also participate one-to-one in their own home with the telephone coaching at a time, that's convenient for them. It could be daytimes, evenings, weekdays, weekends. So we do try to accommodate people. And one of the criteria for matching in the health coach is by age. So, if someone is in their 70s or 80s, we're not pairing them with a health coach in their 30s. It would be with a similar age health coach, because they're going to have more commonality likely in that situation. Charles, maybe you can speak about the group programs and the experience there for elderly people.
Yeah, we've had quite a few people that are up to 92, 95 years old that have participated in the program. So, it's not unusual. And what we're seeing a trend too, this is a bit different. We've seen 30 and 40-year-olds coming into our programs as well. And sometimes that intergenerational mix is quite interesting. And it really presents a nice dynamic within the group. Because sometimes, we are kind of isolated, and COVID has kind of made us isolated. And bringing us together in small groups, we see that intergenerational interaction. And that is really interesting and fascinating to watch. And, and the other thing too, is that we live in a very electronic world. In some cases, you can phone somebody and never talk to a person. And that is unfortunate. And the thing is, with our group, we encourage people to call, and if they get a voicemail, we will call them back. and we will give them, and they will actually talk to a person on the other side of the phone. That's, whether it's in a health coach group or whether it's within the coordinator group that I work in, they can actually talk to a live person and get their questions answered, as opposed to sending an email into the oblivion and hoping it gets answered. Because we really like it when people call us and have questions and we can talk to them one-on-one. I think that's a huge issue. And because I know that a lot of seniors really sometimes don't like working on the computer and don't like sending in things. So we are happy to get those phone calls. I think Marette had a suggestion there too.
I hear what Marcy's saying, and I think that there are two groups out there. I think, and I'm thinking of a 90-something-year-old lady that I had for health coaching about a year or so ago, and who was not at all inclined to learn about doing things on a computer, but was quite happy that I was calling once a week. And we had, some very productive conversations. There are other seniors, perhaps in this, maybe the 60, 70 age group, that are a little more focused on learning computer skills and going out and having classes at the library and things. And they seem to be happy to look at the online stuff in that. And so I think there is a divergence there, and we're probably trying to capture something for both groups, and hopefully doing it well.
And people can attend any of our programs more than once. They're welcome to go through all of our programs if they'd like to. We just recommend not more than one program at a time. And they may go through one of the group workshops and then want to work one-on-one with a health coach to solidify their progress and to keep, working on building their confidence and keep working toward their goals. Or perhaps after coaching, okay, now they're ready to engage with a group of people and get more ideas about living healthfully with their challenges. So I think there was something else you asked, Marcy, and I don't know if we fully answered your question. Yeah. Oh, you're on mute there. Yeah, sorry.
Sorry, those are great answers. Very, very helpful. And it's just some people that are kind of reluctant to start out. So part of it, I think, is the more our people that work with the people that they know can help them feel confident about going, right? And help them know about these alternatives. So I think as much as your answers are, they're useful for the people that are supporting other people in the community already, so that they can help them sort through the different alternatives.
Exactly. And it can take, more than one encouragement, to get someone to give us a call and, to explain the different options to them and ask what they would like to do, what they'd like to start with. But, our programs are underutilized, and yet, they're evidence-based, they're proven to be effective. So, I was talking earlier about self-efficacy and that the intention of these programs is to build people's confidence and their belief in their ability to better manage their health and to deal with the challenges, keep taking those steps forwards when, barriers come up and challenges and difficulties arise. So again, they may start out with lower self-efficacy, avoiding challenging tasks, believing that, difficult tasks and situations are beyond their capabilities, or, tending to focus on the negative and the personal failings and, not having confidence in their ability. And, again, from these programs, they're proven to help people, regain that sense of control in their life. They have a deeper interest in their activities. They've got a stronger sense of commitment to their goals. They recover more quickly from setbacks and disappointments, and they view challenging problems as tasks that they can master. So we're talking about this in sort of the framework of health, but these strategies and these tools and the confidence and motivation they're gaining could be applied to any circumstances in their life. And having that more informed, activated client that that you might be working with or people in your community is obviously going to be a tremendous benefit, not just to the participant and the people around them, but to those who are working with them and trying to provide services and encourage their engagement. So, really, really strongly encourage you to, if you have further questions, to contact us and to, look at ways that we can help you, to help them. So.
Great. Thank you, Karen. What a great note to end on. All the contact information is in the chat box. You've probably seen it there, but I would just like to say again, thank you so much, Karen, Charles, Alan, and Murat. And thanks also to Gemma Bridgefoot, our behind the scenes Zoom expert. And thank all of you participants for joining us today. We know everybody's really busy, but we really appreciate you joining us for this very important session. And please, it will be on CORE, the recorded version of it. So please do go ahead and forward it to others in your networks who you think will find it valuable. So again, thanks everyone, and have a great rest of the day.